Hey, Dr. Lindsey and Lindy here. This is a 7-month update on a male to female transgender patient that had a whole bunch of surgeries,
Yes.
including an aggressive brow lift and then a repeat aggressive brow lift and a temple lift, and had a bunch of scarring in the temple and still too high of a forehead. And so we lowered the hairline and did an effeminate hair pattern, as you can see in this outline. And then we packed those grafts in there.
Yeah, they were nice and packed there.
And we packed across the front and into the scars. And then the patient walked in yesterday and unannounced. And I just grabbed the camera and did a little brief interview that shows a 7-month update. And it's thick, wiry, bristly hair. There is a good color contrast, which doesn't help anybody between the dark hair and white skin. But that thick hair, man, that covers good. And it's probably only half growing because of all the scar tissue. So take a look at the brief video, and then at the conclusion of our video here we have the entire initial video showing the surgery. That's better lighting. Yeah. So 7 months ago, we did... 6 months ago. We advanced that hairline down, put a bunch of hair in some brow lift scars.
Right there.
And so it's half growing. That's pretty good.
Yeah.
Pretty good for
so
6 months.
6 months is really good, yeah. And it was all scarred down because she had the brow lift scar.
Good. Anything you want to add, Wendy?
Well, she is very happy. Like always. She wants to lower just a little bit more.
You were just laughing that we always say that everybody has hair greed eventually.
Yes.
All these bald guys got hair greed. Some of our women get hair greed, and even our transgender patients. Everybody wants more hair.
Well,
right?
More hair is better, right?
Yeah. And so we'll wait until it's fully grown in before making any decisions.
She agreed on that. So she's going to wait for the 13 month and get a second one.
We'll see what happens in 13 months. But if Wendy and I can help you, please give us a call. Thanks. Hey, Dr. Lindsey here. Let me introduce this case, and this patient does live locally, so hopefully we'll get some follow-up over the next 12 to 18 months. This is a 40-year-old male to female transgender patient who wants her hairline feminized and advanced. And she's gone through a bunch of misery trying to get this hairline dealt with. I think she said she had 4 brow lifts, or reverse brow lifts, where the hairline's advanced. And 2 of them have been done, were supposedly by a very aggressive guy in our area. And all it's left her with is a pretty wide scar going into the temporal sideburns and down along the over the chewing muscles. And then a distinct, unnatural looking hairline across the front. So we'll do a strip case today and pack as much hair as we can into the scar. And we've had a pretty good track record of putting hair into scars. We cut the grafts a little chunkier, so there's a little more meat around the bottom of the root, and we make the holes just a little farther apart in the scar tissue. And then when we come across the brow, in front in the forehead skin, we'll do it just like a regular hairline, except it'll be a feminized hairline. So this is what we do. I've got before pictures and 7-day pictures and videos from throughout different stages of the case. Everything went really well. The patient's got really thick, bristly, wiry hair, which helps cover. In addition, those thick, bristly, wiry hairs they're like big, bristly bushes. They have good root systems on them, so I would expect this to work. It'll just take a while because of the scar tissue. And she did a great job cleaning. She came a couple times during the week, and Wendy cleaned her up, and hopefully we'll get her back in a month for a scar check, and then at 6, 12, and 18 months. So enjoy. Thanks. This person has had a number of brow lifts to try to advance this, not by me. It's still a fairly masculine hairline, so we're going to bring it down and try to get some hair in these scars. Going for her, she's got really good thick hair, going against it, that's a lot of scar tissue. So we'll get this done today, and it'll take a good year and a half to get a final result, given all that scar tissue. So now we've started numbing up the front, but you can look and see so much scar tissue from all these brow lifts. Here on this side, and across, and it's even worse on this side. So we'll try to get that hairline advanced downward and feminized. So there was a ton of scar tissue from all these brow procedures. So we packed grafts in there, or packed slits in there, and we just put the PRFM in. And now we'll place the hair. These guys over to the side are aimed down in the normal direction of downward hair. The rest of them are aimed in the usual
And that's down
radial fashion. Okay, so we've got this part done, and it turns out we have a little bit more hair than expected, which is good. And so we're going to go in a little farther into these lateral extensions of her brow lift and deal with that. And this should be a good result. It's thick, wiry hair and pretty well packed. So this is the day 7. The stitches are just coming out, and that scar looks perfect. You did a great job keeping this thing clean. So put some vitamin E on it and take it in a month.
So you'll see right now the front looks perfect. What she did is she was putting vitamin E 3 times a day onto the recipient area. And that, you know how she has her hair is very, very thick.
Right.
And there was like a lot of crusties, but she started putting vitamin E.
Yep.
3 times a day, and that when she washed it, it helped to get rid of
good.
other. It looks really good.
And that is stuck in the scar.
That right there, it's look, yeah.
Good result for that scar.